The electrochemical activity of the brain can also be measured by a device called as a EEG, which is a electroencephalogram. So this gives a graphic recording of the activity of the brain, just like an EKG gives about the heart. So when there are like excessive stimulation or activation of the electrical activity of the brain, it might give rise to a condition of tremors and seizures in the individual. So the physician will have to figure out a way as to where these excessive triggers are being developing. So sometimes they might find a focus which is called as the epileptogenic focus, meaning this gives rise to the onset of such tremors and seizure disorders called as epilepsy. So there are various types of epilepsy that we need not go into detail, but what it is concerning to us is like the procedures that the doctor does in the monitoring of the activity of the brain. So sometimes there might be depth electrodes placed. So usually what happens, EEG is being done by placing the electrode into the brainy substance or on top of the head. So when in the case of depth electrodes, what happens is the electrodes pass deep into the ventricles in order to measure the pressure in the brain.